Sarah, you can go ahead.
Thank you so much. And good morning, everyone. And thank you so much for joining us today for this important discussion. My name is Sara Singh, and I'm the member of Provincial Parliament in the riding of Brampton Centre. And I also serve as a deputy leader of Ontario's New Democratic Party. I'm joined today by my colleagues, MPP Kevin Yarde and MPP Gurratan Singh, who respectively are the members from Brampton North and Brampton East. And we're here for a very important conversation with our federal leader, Jagmeet Singh, to discuss some of the challenges that our community in Peel are facing. The Brampton and Peel region have been a hotspot since the start of this pandemic, and yet Doug Ford and the Conservative government here in Ontario continue to fail our community. Our essential workers are still waiting for vaccines and appropriate numbers of paid sick days. Many are still going into work sick because they do not have the option to stay home. We hear these stories, these heartbreaking stories every single day about entire families in the ICU and the resources being stretched to capacity. I'm pleased to be joined by our federal leader to discuss some of those challenges and many healthcare professionals today to figure out how we can work together to continue to advocate for communities like ours. I'll pass it over to our federal leader, Jagmeet Singh. Thank you.
Thank you so much, Sarah. Big shout out to you and to the entire team at the Ontario New Democratic Party who are fighting so hard. Andrew Horvath, our leader, and Sara Singh, Kevin Yarde, and Gurratan Singh are fighting hard in this difficult time. I got to say, what I'm hearing from the Peel region is heartbreaking. Like Sarah said, these are the workers that are the most important workers, the most essential workers who have to go into work, can't stay home, the frontline workers. These are the workers that are getting sick, and then their families are getting sick as well. Entire families are ending up in the ICU units, and we are seeing deaths that could have been prevented. And the recent death that lots of folks are talking about, the loss of Emily, a 13-year-old whose father got sick at work, and then she ended up passing because of COVID-19. These are lives that we can save. These are deaths that we can prevent. And we know two things, two very clear things. The people who are most vulnerable, the people who are on the front lines, the people who are working to keep the goods that we need flowing, to keep the food that we need arriving to our doorsteps and to our communities. These are the folks getting sick, and these are the folks that are not getting the vaccine. So we need to vaccinate the people who are most vulnerable, who need the vaccine the most. Them and their families need to be vaccinated. That's one. And secondly, we need paid sick leave. There's no question about it that at the provincial level, Doug Ford has been a disaster, and it has resulted in lives being lost that could have been saved. And at the federal level, we have a paid sick leave program. The problem is it's just not working. And so it's not about jurisdiction. There is an existing federal program which needs to be improved. And it shouldn't be a battle between finger pointing between provincial and federal. We need to save lives. These are workers whose lives are at risk because they are going to work sick, and they will not be able to stay home until there is a program in place that ensures that if they stay home, they have paid sick leave and can remain safely at home, but know that they can put food on the table and pay their bills. That's what we're fighting for. We're fighting for the most important workers. But we also have to mention are often new Canadians, racialized, people that already are vulnerable are the ones that are now paying the price of the inaction of government to protect them and to save them. So we are here to fight for them. And I also want to now introduce Dr. Alam Damji, who is the head, the physician lead for the assessment centers as well as the vaccination centers in Mississauga. We know that we need to get the help to the communities in need. And so we want to hear from someone who's leading the charge at the frontline healthcare worker level to get people assessed and vaccinated. So with that, I'll pass the mic now to Dr. Alam Damji. We'll just try that again with the audio rectified. Doesn't sound like the audio is working. And so maybe what we'll do is
My name is Dr. Ali Damji, and I am a family physician, addiction medicine physician, and a lead for the COVID-19 assessment centers in Mississauga. I am here speaking with you today as a proud resident of Peel Region and a concerned physician. I am not speaking on behalf of any particular political party, nor any organization that I'm a part of. Our region is in crisis right now, and particularly our essential workers are in need of support. They are falling ill with COVID-19 at alarming rates in our region, and we are seeing growing rates of workplace exposures, as well as exposures amongst household members and family members of essential workers. Approximately 53% of Peel's entire workforce has continued to work in person throughout this pandemic. The reason for this is that they're working hard to ensure that the rest of us Canadians can stay home safely. They are ensuring that so many different aspects of the Canadian economy are maintained, that supply chains are maintained, that manufacturing is maintained, so that the rest of us can safely isolate at home. As a consequence, they are putting themselves at risk, and we are seeing that in our community as more and more essential workers and their family members are ending up in our hospitals and ICUs. This problem is only getting worse due to the new variants that have emerged in our community. According to Peel Public Health, approximately 8,000 workers were identified in our region as having COVID-19. Of those, 2,000 of those essential workers ended up going to work despite having symptoms, and 80 of them ended up reporting to work despite having a positive COVID test. This truly shows the desperation that's in our region right now, where people are being forced to choose between following public health advice or feeding their families. As a society, we need to reflect on whether or not this is the legacy that we want to leave through this pandemic. I urge you to please support our essential workers. They need access to vaccination. They need access to paid sick leave that allows them to stay home if they become sick, that allows them to have access to vaccinations and take time off for it, that allows them to be able to get COVID tests when they need to, and they need their employers to support them throughout this pandemic. Thank you so much for listening.
I want to thank Dr. Ali Damji for the message. Again, reiterating exactly what we know. The frontline workers, the essential workers that are so important to us are the ones that are getting sick, and they're the ones that are now then, as a result, infecting their families. They cannot stay home because they have bills to pay. They need paid sick leave and they need to be vaccinated. We are here to say we need a better response that supports the people that are most desperate, that are most in need, and gives them the ability to stay at home when they're sick, and gives them the ability to make sure that they're safe by getting them vaccinated. That is what we're calling for. This is desperate. We've spoken to frontline health workers who are at their end. They're seeing horrible conditions. They've got to make impossible decisions between who to keep alive, who gets access to a ventilator. This does not have to be the way it is. We need to get help to these communities. People are hard hit. We need help to be there for them. And so that's why we're doing today's announcement. We are going to continue to put pressure to get help to the communities that need it most. With that, I'm going to pass the mic to Nina. Before I do that, encore en français, ce que je veux dire aujourd'hui, c'est le fait que les communautés les plus vulnérables sont les plus frappées par la COVID-19. C'est les gens qui tombent malades et aussi ils ont risque de partager l'infection à leur famille et leur communauté. Donc, ce qu'on veut voir aujourd'hui, c'est on va continuer de mettre la pression pour avoir un programme de congé des maladies payées qui fonctionne et aussi de s'assurer que les communautés qui en ont le plus besoin sont les communautés vaccinées pour les protéger. Ce sont les travailleurs essentiels, leur vie est en péril, on doit les aider tout de suite. With that, I want to pass the mic now to Nina for any questions the media might have.
Merci beaucoup. Thank you very much. So I would like to invite members of the media to please use the raise hand function in order to ask your question and follow up. J'aimerais ça inviter les membres des médias d'utiliser la fonction lever la main pour poser votre question et question de suivi. We will start with Alex Belingo with the Toronto Star. Please go ahead.
Hey, good morning, everybody. Just my questions for Jagmeet Singh. On Bill C-12, I know it's a different topic. I know you guys are talking about obviously an important subject, but I'm writing on this today. My understanding of the situation is that the bill's at second reading. The Liberals want to pass as soon as possible. The NDP supports the general idea, but you guys want some amendments. So what exactly is the situation there, and what do you guys want to see changed in that bill so that you can support it?
Thanks so much for the question. What we've seen with, so this is the bill that touches on accountability for the environment. And this is a vital piece of legislation, because we know while we're dealing with the pandemic, while we got frontline workers that are right now in horrible conditions, while we need to get the vaccine to the communities that are hardest hit, and we need to make sure there's paid sick leave in place, we are still dealing with a climate crisis. And that climate crisis is real. It's not a distant future issue. It is right now. It is impacting us. We're seeing forest fires, we're seeing flooding, we're seeing extreme weather that is directly impacting people. The problem with the Liberals bill is that it, in terms of the accountability, what we want to see is the accountability start right away. They're pushing down the deadline, or pushing down the accountability to start further down the road, where we can't afford to do that. What we see with the Liberals is they often signal the right things, but they don't do the right things. And this is another example. There's a lot of strong measures, but they're not starting the actual accountability till too far down the road. So we want to see it happen sooner. We want to see accountability happen right away. We also want to see more teeth with the accountability. The UK model is the best example of how the accountability, the climate accountability has worked. In the UK, strong accountability laws have meant that governments have been held to account, and they have reduced emissions. So really, at the end of the day, we know the solution to the climate crisis is reducing emissions. But this Liberal government and previous governments have set targets that they set and then miss. And that does not help anyone. So that's what we want to see: real accountability. We want to ramp up the timelines, and we want to see a real commitment to reducing emissions that follow in line with the science.
And just follow up on that. I saw a letter that the Environment Minister had sent to 2 of your MPs, and I think you as well. And he touched on that they might be willing to change the bill so that there is more reporting, I guess, progress reports that happen in 2023 and 2025 instead of just in 2027. Is that enough for you guys to on the more accountability sooner?
Well, we're encouraged by the fact that we have been fighting for more accountability. We're fighting to protect the environment, and we've been able to successfully force the government to move towards better accountability to protect the environment. So we're encouraged by that. We're still in the midst of some of these negotiations. We're still working hard to get better protection in place, because this is a real crisis we've got to deal with. So we'll give you updates as we know them, but we're continuing to put pressure to get the best deal possible for Canadians, the best law possible to protect our environment, because we know while we're dealing with the pandemic, we also have a climate crisis that is still here, still real, and we have to tackle it.
Next, we have Sabrina Gamrat with the Brampton Guardian. Please go ahead.
Hi there. Thank you for taking my question. So we know that Brampton and Peel region has been, lacking in vaccine rollout for a long time. That's not news. And so I've been speaking to a bunch of residents, and given the makeup of Peel in terms of people and diversity and culture, some have said that it's just plain discrimination or even racism, that after all of these calls, Brampton still isn't getting their fair share. And so I wanted to hear your thoughts on that.
No question about it. Every single member of parliament federally is a Liberal. And there is no action at the federal level to acknowledge how dire the situation is. We're in a dire situation in Brampton and in Peel. Given how serious it is not good enough for the federal government to put up their hands or to point and blame the provincial government. We all know the provincial government, the Conservatives, Doug Ford, has been a train wreck. But that does not help to just point and say that he's a train wreck. The federal government's got to step up. They've got all these members of parliament that are Liberals that are doing nothing to actually get help to this community. We've got members of parliament, members of provincial parliament, like the ones that we have online right now, Sara, Gurratan Singh, Kevin Yarde, who are fighting every single day to get more help to Brampton. We've got a federal government that ignores them. We've got a provincial government that ignores them. People are desperate. And the only evidence that we have is that we've got a community that are highly racialized, that are new Canadians, that are essential, that are fundamental. Everyone is benefiting because these workers are going into work, but they are putting their lives at risk, it is clearly systemic discrimination that these are the most important workers that are being denied basic things like access to vaccines and paid sick leave. It is clearly discrimination against the workers that are the most important. So yes, it is, and it is offensive. And that's why we're here to say we need more. That's why the Ontario New Democrats are fighting for this. That's why I, as leader, national leader, are here to say we've got to get help to these communities. These are the people that are most vulnerable. They need help and they need it now.
Sabrina, did you have a follow-up?
Yeah, thank you. I just wanted to hear your thoughts on those. So it has been promised that Peel Region will see about a 50% vaccine rollout starting next week. Is that enough? Is that coming too late? I mean, what are your thoughts on that?
It is absolutely coming too late. We need it. So let's see that support. But we've known this for months. It's been clear for months and months that Brampton was a hotspot, that Peel was a hotspot, and everyone knew that these workers have to go into work. It was known that these are workers that can't work from home. They've got to go into work, and they do it because all of us need the goods and supplies that they provide through logistics, through the warehouses, through the factories. So they are providing an essential service to all of us, but these workers are being neglected and ignored. That is the problem here. And this has been known by the federal government, by Justin Trudeau. It's been known by Doug Ford for months, and they've not done anything. The evidence has been clear. The public health experts have been asking for a better vaccine rollout. They've been asking for paid sick leave, and there's been nothing done. And so announcements of help in the future, it is late. It is far too late. So many people lost their lives that didn't have to, but we want to see immediate action. We want to see paid sick leave that works, and we want to see vaccines that are rolled out to communities that need it most. It is offensive that the poorest communities with the highest rates of infection are the lowest rates of vaccination. And then conversely, you've got communities that are the wealthiest with the lowest rates of infection that have the highest rates of vaccination. That is a colossal failure. And so we need to fix that with the urgency required.
Thank you very much. Merci beaucoup. Just a reminder to media, if you'd like to ask a question, to please use the raise hand function. Pour les médias, si vous avez une question, veuillez s'il vous plaît utiliser la fonction lever la main. Next, I have David Thurton with the CBC. Please go ahead.
Hi, Mr. Singh and everyone. Good to see you all. I wanted to ask you a question about an article one of my colleagues, Aaron Wary, wrote about sick leave, paid sick leave. And it raises the question about whether the federal program may have, caused a bit of inaction at the provincial level. So how does your calls for the federal government to improve its sick leave benefit motivate the provincial governments to act on this, to improve the program so it does what you're calling for?
Well, we have two tracks and both are equally important. And I want to really highlight this. Provincial and territorial governments absolutely need to put in place legislation that ensures that workers can take paid sick leave, that they are not going to be fired for taking paid sick leave, that they have extra supports in place. That has to happen. That is independently important and must happen at the provincial and territorial level. So that's, yes, 100%. But we have a program at the federal level. There is not a question of jurisdiction here. And don't let the Liberals spin you the wrong way on this. There is a federal program. It's simply not working. They clearly know this. They budgeted billions of dollars for this program, but it's only been, uptake has only been about $700 million. So clearly, they budgeted for it to be a lot more. They knew it was supposed to help people, but it's not working. They know it's not working. Experts have said three things. It's got to be more flexible. It's got to be quicker and easier for people to access the money. And it has to cover the worker's salary, whatever they would have made if they went into work. That's what we're saying. Justin Trudeau knows this. He knows that this program is not working and has failed to fix it. In doing so, he has left people to go into work sick, risking infecting their colleagues, risking infecting their families, and people have gotten sick and died because of this inaction. So both of those things have to happen. Provincial governments need to make sure there's paid sick leave legislation, and the federal government, Justin Trudeau, needs to fix the existing program right now, make it work. Like, here's a bright idea. If we've got a paid sick leave program, shouldn't it actually work to cover the workers who need it most? That's what we're asking for.
But we know that the Ontario government was waiting to see in the federal budget if there would have been any enhancements to the federal program. And I know you're taking a two-track approach, calling for action on this, but has this breeded some sort of inaction at the provincial level, you think? Do you think that this approach that either yourself or the Liberals have taken have just motivated this I guess, inaction at the level of the provincial government?
Justin Trudeau knew this was a problem. Because he hasn't fixed it, people have died. Justin Trudeau is responsible for the deaths of people because they couldn't take paid sick leave when he knew full well the federal program was not good enough. That is Justin Trudeau's fault. It is Doug Ford's fault that he did not bring in legislation to protect workers to ensure that they had provincial protections. It is both their faults. But at this point, I could care less whose fault it is. I want them to fix it because people are dying. People are going into work sick. So I'm not here to win the battle of who's most at fault. They're both at fault, but they both have responsibility to act now to fix it. And both can independently fix this right now. Justin Trudeau tomorrow could bring in legislation and we would pass it immediately to improve the paid sick leave. So why doesn't he do that? Doug Ford could bring in a better paid sick leave program and make sure people have legislative protections right away. But he chose to do the minimum. Both of them are failing people. And the thing is, in this failure, people are dying. And that's how desperate and dire the situation is, and why we need to see immediate action on paid sick leave and a vaccine rollout that actually gets to the communities that need help the most.
Thank you very much. Merci beaucoup. Next, I have Logan. Logan, if you can identify also your media outlet, that would be super helpful. Thank you. You are still on mute.
You hear me now?
Yes, Logan.
Yeah. Oh, good morning, leader. I'm Logan from the Tamil News.
Oh, vanakkam.
Vanakkam.
Greetings.
Yeah, I'm very glad, and most of our ethnic media colleagues, they watch you, and they know what you do. As you said, you all are working hard, and the provincial leader with the support of her MPPs, she's doing good. So we watch everything. So we are very glad. So Mike, before I go to the question, I have one very simple question, but I got shocked to hear from the doctor who was speaking today. He said about 2,000 frontline workers, they have symptoms, but they go to work. Oh, it's very dangerous. It's unbelievable. You see, so this is not a, this is the issue about the disease. It's not the governments, not individuals. But the government should take action. My question is, Jagmeet Singh, I remember during the beginning stage of this corona, COVID-19 in 2020 March, I carried a news. Justin Trudeau, Prime Minister, announced 3 fundings. I carried the story. I have the names of the doctors and the scientists. The funding went to 3 universities not in Ontario. I think one of them in the Prime Minister announced $1 billion for each team. So I was very anxious. I was very anxious to know about that, the results and what is the progress, what is the process there. I never heard because I watch everything every day. I watch, but I never heard a story. What is the results and what they have done, and how they utilize the funding. If you can remember those things, I can send you the information. I will send you the translation. That was in March or April 2020. It's a big funding. Yeah, it's a $1 billion and $3 million, you see. So if you know anything about that, I will be very glad to listen to you,
Sure. Thank you so much, Logan, for the question. We can get back to you on details about where that funding went specifically, and our team will follow up with you if you can just to give us your contact information, maybe in the chat. But I can tell you in general, one of the biggest failures at the beginning of this pandemic, what the Liberal government didn't do is they should have invested immediately in building the capacity to produce a vaccine in Canada. And this is something that has been a serious failure, the lack of domestic production. We have been far behind other countries that are even smaller economies. We're one of the world's largest, but even smaller economies were able to produce the vaccine locally and had more supply, and were able to vaccinate their communities and their population, the people, much faster. So the money that was spent up front should have went to something that we said should have been a publicly owned capacity of producing vaccines like we used to have. It was called Connaught Laboratories. So we've been calling for this for months and months. From the beginning of the pandemic, we knew we needed to have local production, and that has been a major failure. We still need to do that because we know there's going to be future pandemics. We might need additional vaccination in this pandemic as well. So we need to be able to produce the vaccine here in Canada, and we need to own that ability. It should be owned by Canadians. So we're going to continue to push for that. So that funding certainly was not placed in the right way because we didn't build a local capacity, and that is a serious failure of the Liberal government.
Thank you very much. That was our last question. So this concludes our press conference. Ceci met fin à la conférence de presse. Merci.
Thanks, everybody. Big, again, shout out to the Ontario NDP. Really good to see you all. Sara, Gurratan, Kevin, thanks so much. Take care all. Thanks to the media for being here. Thank you. Take care, everybody.